What does my posture have to do with anything? Good morning. My name is Dr. Tyler Hamill, Kingwood Chiropractor. When patients come into my office that are struggling with neck pain and back pain, almost all the time, posture or postural stress is one of the contributing factors. So, how is this happening and how is it affecting our health? So, think about our head. If you look from the side, if we had really good posture and sitting upright, our head weighs about 10 pounds, 10 or 12 pounds. Think of it that way. So when we're in good posture, this is the least amount of stress that you would have, say, on your neck and on your mid-back. But as you start to go forward, 1 inch forward translation, say if our neck going this way, adds an extra 10 pounds. So it doubles the amount of the weight on our head, putting stress, twice as much stress, say, on the spine, and up to 6 times more stress on the muscles that are surrounding the spine. That's with 1 inch moving forward. So how about if I'm somebody who's on my phone all day or on a computer and I'm slouching over this amount, right? So 3 inches forward, that's going to be 30 extra pounds on the neck and on the mid-back. So most people think about, I know my posture is not good. I know I need to work on my posture. I know I slouch over. So, and that's going to affect things like neck pain or stress in the neck or muscle spasms or headaches, right? We all know that. We all know it's important to work on our posture, but there are some other things that posture really affects. So, kind of on a side note, think about, say if I have this ball here and it's a 10-pound ball, just to get an idea of the amount of extra stress that you would have on your neck. So if I hold this ball just close to me here, close to my chest, say it's about a 10-pound ball, I'm holding it here, it doesn't really feel that heavy to my arm, right? Because it's really close to my body. But if I bring that ball way out like this, say towards you guys, that feels like considerable stress on my shoulder, right? Just moving it out, say, a foot in front of me. It feels like 2 or 3 times the amount, or even more than if I'm just holding the ball in here. So it's the same thing with your head. Think about your head being in a good posture this way, or when you're working on a computer a lot, it's going over this way. Same exact thing. So besides neck pain and back pain and headaches, what else does posture affect? So think about being in a position like this. What else is it going to affect? So it's going to affect your breathing. It's been shown that it's going to affect lung capacity. It's going to affect your blood pressure and even your pulse. And they've also shown that it's going to affect endorphin release in your body as well. So endorphin release, you think about kind of your body's ability to deal with pain. Is that a good thing or is that a bad thing? Is it making that worse or not? Also, just think about circulation in general. Think about how you're going to feel when you're over this way all the time. Are you going to be more anxious? Are you going to be able to handle more stress? Probably not handle more stress being in this position, right? So this position doesn't do a whole lot of good for us, putting stress on the neck and the back. It's making it a little bit tougher to breathe for us, right? So posture has a lot more to do than just neck and back pain. I see Norman's watching out there. Thanks for watching this early in the morning. I know this is an early live video, but I just thought I'd get this out there. So think about postural improvement, what we need to do to fix it. So we have a person here now and asking the question, well, if I've had neck or back pain for a while, is this something that I need to improve? Is posture something I need to improve? And absolutely it's something you need to improve. With all my patients that are coming in, I give them specific neck and back postural exercises to do. Think about being in this posture and then coming back up this way. We need to do some corrective exercises to get them straighter. If you go to a chiropractor or the massage therapist or acupuncture, you can get therapy and feel better for sure. But if you go back into that postural stress that you've been dealing with for a long time, and think about postural stress, it's a cumulative type of effect. It doesn't just happen overnight, but postural stress, leaning forward like this, thinking of this ball going forward this way and putting that much more stress on the neck and on the muscles, that eventually causes degeneration in the spine. So think about extra compression. So compression anyway, and then compression with an additional 30 pounds of weight from me working on a computer or looking on my phone. You look at kids these days that are just doing this all day. So they are going to have lots of neck and back pain troubles too, unless we can do something to help improve their posture. So another question that a patient is asking here is, well, what am I supposed to do at my office or at my home office right now because I'm working from home? What do I need to do to improve my workstation? So that's a great question, right? Ergonomics, that is basically the kind of the study of setting up your desk or your office in the best way to take the least amount of pressure off your spine or to improve your posture the most. If you just Google ergonomics, you can see, you want to have your screen right in front of you. You want to have your arms kind of at, 90 degrees here. You don't want to be typing up here or typing way down below. These are little things that can make a big difference. And then I always recommend patients that are working on a computer all day, every hour, do a couple of the postural exercises, squeezing the shoulder blades together, getting on the wall and stretching the pec muscles. Every single hour, if you can interrupt that postural stress, it's going to make a huge difference on how you're feeling by the end of the day. So 8 hours on a computer, hunched over like this, that's going to make a significant difference to how your spine, your neck, your muscles, your nerves are reacting over time. And say you're just getting into a job where you're doing computer work, IT work. Almost every job today, you're spending some amount of time on a computer. Some people 4 hours, some 10 hours. So after a year of doing that, you might not feel too bad, but 5 years, 10 years, 20 years of postural stress, I see it in my office every day when patients are coming in and they have changes to their spine. When their spine used to be upright or a little bit curved back, now it's starting to go over the other way. And you can see that on an x-ray. The x-ray, the spine straightens out or starts to go over the other way. So that doesn't happen overnight, but those are the potential effects that you could have from postural stress over time. Okay, one more question here. So a patient asks that what kind of exercises should I do? Or like I'm going to the gym, I'm doing exercises, and what exercises should I focus on to help my posture? So that's a great question. And think about today, you see it in the gym, like lots of people are working on bench press and biceps and things like that. Everybody's doing that at the gym. But you got to remember to balance out the strength in the muscles in the back, right? Your rhomboid muscles squeezing the shoulder blades together. There's a tendency for us to be very strong coming in this way, but very weak going back the other way. So I would suggest balancing that out. Rows, you can do rhomboid squeezes without weight, with weight. And for a little while, I'd try to do twice as much back work or mid-back work than you're doing, say, bicep curls and pec muscle and bench press and things like that, just to try to balance it out some. Because most of us, again, we're way stronger forward and we're way weaker coming back this way. The muscles between our shoulder blades, they become kind of sluggish or deactivated. The pecs and the biceps, they're overactivated because we're using them all the time. So that's a great question. So that's what I would focus on, because most likely people going to the gym, they've been doing way much stuff in front and not enough in back. So I would focus on doing 2 times as much strengthening for the mid-back and the rhomboids compared to what you're doing in the front. That's what I would suggest. So again, I'm Dr. Tyler Hamill. Thanks for the questions this early in the morning. I know it's an early one, but I hope everybody has a great Tuesday morning. If you have any questions about posture at all, post it in the chat box below, or any other questions about chiropractic or postural exercises, things that I could help you with. We're located in Kingwood. I've been practicing for over 20 years, so I've seen a lot, pretty much seen everything that's able to come into a chiropractic office. So I have a lot of experience with that, and I can give you some of my knowledge and experience by helping you answer your questions. So again, Dr. Tyler Hamill, happy Tuesday. If you like this video, if you learned something, please share it. There's lots of people out there that need postural help, posture or postural stress. It is the key or the main contributing factor to neck and back pain today. If we don't do something about it, we're all going to be in more trouble, taking more medicine, maybe getting surgeries and things like that, where we definitely don't want that. So again, Dr. Tyler Hamill, your Kingwood chiropractor. Have a great day.